Coronavirus cases in parts of North and South Idaho reaching record levels. Today, the Panhandle Health District moved two North Idaho counties to its highest risk category for the very first time. Kootenai County's testing positivity rate is above 20%. Kootenai Health is nearing capacity and may have to transfer patients now out of state. As we reported last night on the news at 10, health officials are also very concerned about the lack of hospital capacity in south central Idaho as COVID-19 cases surge in the Magic Valley. The trend is also concerning for health leaders in the Treasure Valley. Our Katya Stepovic takes a deeper dive into what all this could mean. Katya?
Well, unfortunately, COVID cases here in the Treasure Valley are accelerating at similar rates compared to south central and northern Idaho. Spokeswoman for the Idaho Hospital Association says the state is on the brink of entering a crisis phase.
Right now, across all four of our acute care hospitals, we're at nearly 100% capacity. We have the ability to surge beyond that capacity to an excess of 100% capacity. At that point, things become more stressed and we have to compromise on our staffing ratios and so forth. We are not at that point yet, but we are close.
Dr. Stephen Nemerson, Chief Clinical Officer with St. Alphonsus, says at their four hospitals, the test positivity rate a month ago was about 7%. Now it's over 16% and climbing. He says they are shuffling patients across the system using different clinical areas that would not ordinarily be used, and soon elective surgeries could be put on hold.
I would suggest within the next couple of weeks, we'll be at a point where if things don't settle down, we're going to have to reduce those non-emergent procedures.
Dr. Nemerson says St. Alphonsus has seen an increase in overall medical needs, so that, coupled with a surge in COVID patients, is alarming. But even more alarming, some would say, is the idea of losing medical staff to the virus, right when they're needed the most.
We're all fatigued with COVID. Hospital staff are more fatigued with COVID. I think it's important to note, folks look at the total number of rooms available in hospitals, but those rooms aren't available if we don't have staff.
Tony Lawson with Idaho Hospital Association says that every hospital in Idaho has come up with a surge plan that addresses how to handle excessive numbers of COVID patients. And typically, the plan includes shifting patients around to hospitals in other states. The problem is there's a limit on the number of patients they can take, and oftentimes the type of patient, too.
So it's going to be a constant challenge to see who has space available, what type of patient they can take, what their acuity level is. I think, for the average Idahoan, it's kind of scary to think that you could go to your local hospital in an emergency and end up in another city or another state to get the care that you could usually receive in your local hospital because they were at capacity.
Medical experts like Dr. Nemerson will say it as many times as they have to.
We have the opportunity to change this trajectory. And if people will just stay away from one another, keep their faces covered, we could see this settle down within a week, and we could see a turnaround within 2 weeks.
Both Nemerson and Lawson say the next 2 weeks will be crucial in determining the future status of hospital capacities here in the Gem State. They say they will be looking at those numbers very closely and that we should all be doing the same. Mark?
Absolutely. All right, Katya, thank you.